All right. So, good morning, my dear friends, ladies and gentlemen, and very warm welcome to yet another episode of Empower Hour being hosted by Association of Nurse Executives India. And this month, the session is going to be hosted by Punjab chapter. But before I invite them, let me share with you some informations on, you know, uh, our association. Okay. So, friends, this life learning ignited futures. This is our focus for this year. Annie started this endeavor in 2021. And this came from our advocacy committee's, suggestion. And since then, the central office of, Annie has been hosting this, but with the help of different chapters or individuals. Last year, we had discussed the WHO patient safety curriculum through our Annie patient safety fellows. All the Empower Hours so far we have held has all been recorded and they are all uploaded on Annie's, YouTube channel. You can always go and find them, learn from them, and make yourself more safer. So this year, Education Committee had collected almost 100 plus, patient safety events, and we are very happy to announce that it is now with publishers. We are hoping it will get published, and there are about 40 plus contributors there, so it is getting into a book shape, and from that book we are taking one event every month, and different chapters are taking the responsibility of doing this in a very innovative manner, not through a lecture but rather sometimes discussion, role play of the entire nursing team, how they are handling the error. And recently, many the innovative ideas have come in. People started, showing the videos of the event, then the discussion. And we also, this year, when we had our annual Annie conference at Hyderabad, we also have, promised that we are going to be unsiloing nursing. What does it mean by unsiloing nursing? That we are going to involve other professionals of the healthcare system into our discussions. So we did have, anesthetist joining us when the Northeast chapter was, hosting it. And today, I think Punjab also has got a senior person joining. So I will not, talk about it right now. So let me do what's my job to do. My name is Thankam Gomez. I am the founder, member, and the first president of Annie. And currently, the president is Captain Ajita Nair. Vice president is Dr. Unmana Burgohain. Our secretary is Vinci Tribhuwan, and treasurer is Professor Dr. K.L. Ajit. And they all are from different states. And that showcases that we are for entire India. And we are very happy that we have 14 chapters. And if any one of you is interested to start a chapter in your respective state, let us know. So the event that is coming up after the ANECON is our annual patient safety conference. The World Patient Safety Day falls on 17th of December. So this year we have our focus on towards zero harm. WHO's theme this year is elevate. May I request everyone to please stay muted? This is a simple request. And if you are here in the virtual platform, this much of discipline is mandatory. Please look at your system. On the mic, there should be a cross. We don't want anyone to unmute themselves and disturb what is happening here. Thank you so much. Elevate the voice of patients. This is the theme from WHO, and that's what we have also adopted. And we are planning for a one-day session. But before that, 29th September, there is quality improvement project presentation from patient safety fellows. We started this again in 2021. Cohort 1 started in 2021. They will be graduating this year. We are having this patient safety fellowship in collaboration with Patient Safety Movement Foundation USA. CEO Dr. Michael Ramsey have already met all the fellows this year, and he will be present on 29th when these fellows are presenting their quality improvement projects, cohort 2. Cohort 1 was responsible for doing all the, WHO patient safety curriculum, videos, and, all the sessions. They are supporting cohort 2 to complete their project. So they will graduate. Now cohort 2 will be helping cohort 3, which we will be finalizing before the conference on 30th. So that's the day we have our virtual virtual conference, which is free. And this time it is being hosted by Northeast chapter. So details slowly will be shared. Please save your calendar, and 30th, 29th, the timing is from 7:30 p.m. to facilitate Dr. Michael Ramsey to join. That's for about 2.5 hours. On September 30th, we have from 9 a.m. to 4:30 p.m. So please block your calendars, and we would like to see all of you. Now, this is the call out for, applications for ANEI Patient Safety Fellowship, cohort 3. There are only 7 seats, so you have to send your application to anniepresident@gmail.com. And in case you have any questions around it, you can always call or WhatsApp 9871798914. And that's my number, and I'm the coordinator for this fellowship. So you can always, reach out to me. The eligibility, all ANEI members only. You want to become an ANEI member, apply. You are welcome. You just need to go to www.anei.in and you can become a member. So this is open only for members. You can be GNM, BSc, MSc, but with minimum 5 years experience. This is important. And most important, willing to spend 2 years in the program. First year of learning and project completion, second year of, mentoring the following cohort. Meetings are usually held after working hours. That needs to be noted. And on successful completion, co-branded certificate from ANEI and Patient Safety Movement Foundation, USA. So the last date is 15th September. So hope some of you would like to apply. If you have a passion for patient safety, we are there to help. Also, we have announced the quality improvement projects competition, which also needs to come by 15th of September. Any quality improvement projects involving or engaging patients and families can be, sent to us. There is a template, so the information is on the screen. The email, in case you have any questions, feel free to message any of the ANEI that or even me. No problem. We look forward to good, projects to be coming. We also have announced evidence-based practice competition. Now, for all of you to know, there is definitely a difference between quality improvement projects and PPP. And we did train about 30 people in collaboration with the American Evidence-Based Practice Academy. I hope they are aware that, how that needs to be done. So that also can be sent for competition, and both the competitions, the presenter will get the certificate. The winners, the 3 best ones will be invited to present during the conference. There will be interim jury. And for evidence-based practice, we have Dr. Vijay George, who is our international member, as the jury from US, and she's also one of the faculty, just to make sure the process is, followed correctly. And both the competitions, the team will get first prize of 15,000 rupees, second prize of 10,000, and third prize of 5,000. So that is all my information. Okay. Now it gives me immense pleasure to be inviting the Punjab chapter under the leadership of the Punjab state officials, Ms. Rajbir Kaur Aulak, President Punjab chapter. She's Deputy Chief Nursing of Fortis Mohali. And Dr. Davinder Kaur, she's the Vice President for the chapter ANEI. She's Principal of Gyan Sagar College of Nursing, Rajpura, Patiala. And we have a, host of, sorry about that. We have a host of youngsters, Sorry. Just give me a moment. My mouse sometimes becomes crazy. All right. So we have a host of youngsters, who is supporting in this Empower Hour. Miss Sheetal Kamble, Miss Amarjit Kaur, Miss Shivani Chopra, Miss Parveen Kaur Sangar, Miss Amradeep Kaur, Miss Babita Kashyap, Miss Ruchi Barmaik. So welcome to all of you. And I'm very happy, that I'm sure that we are going to have a completely learning, experiential learning here. And thank you so much, the Punjab team and the secret is that we do have a senior endocrinologist, Dr. Kriti Singh, who will be contributing during the discussion. So thank you, sir. If you are here, thank you so much for supporting us. And please, may I again request, keep yourself muted. Please, and that's a humble request so that the proceedings are not getting disrupted. And also, please do not start your video because I don't want anyone to be, looking at the video of people who are moving around. So I'll be stopping the videos also. Thank you so much. And I think I did see Dr. Unmana here joining. Are you there, Dr. Unmana? Are you there, Dr. Unmana?
Yes, ma'am. Yes, ma'am.
Oh, okay. I did not see. Is Ajita there?
Yeah, she's there.
Okay, great. Before I invite Rajbir to take over, let me request Captain Ajita Nair, our national president, to say a few words, followed by Dr. Urmana, and then we will hand it to, Rajbir and team. Thank you. Thank you, Ajita, for joining. Please. You're muted. Ajita, you're muted.
Thank you. Thank you. Good morning, everybody out there. Great attendance, 174 people. In attendance, I can see Mohali Auditorium and a lot of nurses sitting over there. Maybe few more can join there, I feel. A few empty seats are there. And thank you everyone for joining Empower Hour of this month. A very vital aspect of patient care is going to be discussed over here in the form of a role play, my guess, and that is about discharge education. We do take care of patients with so much of care and compassion and all that, and at the last day of patient leaving for home, if things not happen the way it should be, all the efforts taken may not find the result. So discharge education, preparation for discharge is all part of that, and what can go wrong is what we are going to see in today's presentation by the Mohali Fortis team. And thank you all so much for taking interest in these programs. And somebody who is not able to see today for some reasons can go to our website and see it also. And I would request all of you sitting out there to visit our website and go through our YouTube channel, where you get a lot of education material, and that will really empower you, enrich you with the requisite knowledge so that we can minimize the preventable harm for the patients. Thank you. Thank you all so much.
Thank you. Thank you, Captain Ajita. Now over to Dr. Unmana, who is our Vice President, National Vice President.
Good morning, madam. Good morning, everyone. It is a pleasure for me. I'm sorry my video is continuously on and off due to technical error. By seeing at the session Empower Hour, I really feel that ANEI is giving the full empower to the upcoming new generation of nursing profession and who are already in profession. Ma'am, can you hear me?
Yes, can hear.
Yes, ma'am. So I'm very happy to be here, and every week I look for, every month in fact we look for this Empower Hour, and particularly this theme for the patient safety. And this is the very important. It is not the very first, the few moments and last few moments are very important. Ultimately, the patient, when they are discharged from hospital, they leave the message for us, they spread the message for society, and this is only the signature they leave with us, that what we are doing doing and how we have cared them. And I'm very sure the drama and the role play, whatever is been continuously doing for the last few months, it is very exciting, very interesting. I'm very sure Punjab chapter will be doing marvelous, and all the best for that. Thank you so much, Gomez ma'am, for giving me this opportunity. That's wonderful.
Thank you, Dr. Unmuna. Thank you very much. So, friends, you have seen two of our national officials here, and I'm not sure if Vinci and Ajiz. So no worries. Without any delay, 18 minutes I have taken, so I can give Punjab's chapter, time up to 12:20 if required. So now, without any delay, let me invite Ms. Rajbir, who is the president of Punjab chapter, to take over and run the show. We are looking forward to that. Rajbir, please come on.
Morning. Thank you, ma'am. Thank you, ma'am, for giving the privilege to do this activity. And good morning to all the participants. I am Rajbir Kaur, ANEI Punjab chapter's president. As we know, we all are here to witness a role play on patient safety. The topic is insulin administration at home. Here would I like to thanks to all my team members and other for their tremendous efforts to make this session possible. At the end of the role play, we will connect with you what all we learned for this session. So now I would like to invite Vice President Devinder ma'am to lead the show. Over to Devinder ma'am, please.
Thank you.
Good morning, everyone. So for this session, we have just discussing one case by the way of video. The first, we will have the patient, diabetic patient who require proper management and control of diabetes. So patient is 50 years old female admitted in the medical ward with complaints of increased fatigue, frequent urination, increased thirst, and the weight loss of 10 to 15 kg. Patient was diagnosed with diabetes mellitus, and her investigations was done. And fasting blood sugar was 202 mg per deciliter, and PPBS postprandial blood sugar was 415 mg per deciliter, and HbA1c was also done. It was 7.1%. So patient was treated with insulin therapy and some oral hypoglycemic agents for 1 week. And when her blood sugar was monitored regularly and was stable and patient was ready for the discharge, then some instructions was given by the endocrinologist. So then comes the nurse's role. So nurse has to tell the patient about insulin administration, dietary management, and the follow-up care. This will be shown by one video. So after one video, we will again see what was happened in the first video, how the nurse has given the health education to that patient and what happened next. So first, I will give over to ma'am, Sheetal, so that they can display the video so we can witness that video.
Can we share the video, please?
कैसे हैं आप? बढ़िया है? ठीक है। जैसे कि मैं देख रही हूँ इन्वेस्टिगेशन आपके सारे टेस्ट ठीक लग रहे हैं अभी, तो आपको डिस्चार्ज कर देते हैं, घर भेज देते हैं, ठीक है? सिस्टर जी, पेशेंट का डिस्चार्ज प्रोसेस शुरू कर दो। मैंने बना दी है, इनको एक्सप्लेन कर दो कि घर पे इंसुलिन कैसे लेने वाले हैं। ठीक है मैम। ठीक है, चलिए। ठीक है कमला जी, ध्यान रखिएगा, अच्छे से लेते रहिएगा घर पे इंसुलिन। ठीक है? आपका डिस्चार्ज समरी रेडी है, मैं आपको भी मेडिसिन ठीक है। मेरे सिस्टर को बुला लिया पीछे से। मैम 2 ही मेडिसिन है, आपको समझ आ जाएंगी, ठीक है? ज्यादा नहीं है, क्योंकि घर पे आपको खुद ही मैनेज करना है ना, तो इसलिए मैं आपको ये मैम ये मेडिसिन आपकी, ठीक है? इंसुलिन, ठीक है? एक तो आपको इंसुलिन लेनी है, ठीक है? इंसुलिन जो शुगर के लिए अभी यहाँ पे भी हम दे रहे थे आपको, ठीक है? तो ये इंसुलिन है आपको सुबह ब्रेकफास्ट से पहले और लंच से पहले लेना है, आधा घंटा पहले, और रात को डिनर से पहले लेना है,
ठीक है, तीनों टाइम लेना आपको इंसुलिन, और इंसुलिन जो लेना है आपको इस सिरिंज है, इसी सिरिंज से आपको लेना है। इंसुलिन है आपको साथ में हम दे रहे हैं, इसी इंसुलिन इसी सिरिंज से लेना है, और 4 यूनिट लेना है। 4 यूनिट कहाँ पे होते हैं, जैसे ये है तो यहाँ पे ये हम इसका 4 यूनिट मान लीजिए, ठीक है, इतना लेना है आपको। यही सिरिंज यूज करना है, कोई और सिरिंज से नहीं लेना, अगर ना मिले कि और कोई ले लो, आप इसी से लेना है, ठीक है। और जो जब आप इंसुलिन लोगे तो कहाँ पे लेना है, ये हमारा जो अम्बलाइकस है इसके इर्द गिर्द जो है, मतलब ये नाभि है ना हमारा, इसके इर्द गिर्द 4 फिंगर इस तरफ, 4 फिंगर इस तरफ और 4 फिंगर इस तरफ, इसके अराउंड हम ले सकते हैं। और जो लेना है तो 90 डिग्री के एंगल पे लेना है, पहले अच्छे से साफ करके फिर 90 डिग्री के एंगल पे लेना है आपको, ठीक है, तीनों टाइम लेना है। और दूसरी टैबलेट आपकी टैबलेट पेंटोस से खाली पेट लेनी है, एंटासिड है गैस के लिए। सुबह जो है खाने से पहले, या चाय ले रहे सुबह बैटी ले रहे उससे पहले ले लेना, ये आधा घंटा पहले ले लेना, ठीक है। और बाकी कुछ आपको जानना हो? नहीं, ठीक है, थैंक यू कमला जी, अपना ध्यान रखना घर पे।
कैसे हैं आप?
Can we stop sharing?
So this was the scene one that we have seen that patient was educated about regarding the how to take the insulin at home. So after 35 days, this patient was readmitted to the emergency medical services with symptoms of giddiness, blurred vision, drowsiness, increased urination, and insulin site hemolysis. And patient blood sugar when it was checked was 495 mg per deciliter, and even urine ketones were present. On further investigations, it was found that patient while taking the insulin, after taking the insulin, patient keep the insulin at the room temperature and used to the same syringe for almost 1 week. So patient in the emergency, again, patient was treated for the diabetic ketoacidosis because patient was in that state. Patient underwent the investigations and treatment has improved. So now this scene we will see in video 2, and what happened next you will see in the video. Share the screen, please. Video.
सर आपके एक पेशेंट है मिस कमला जो कि 35 डेज पहले डिस्चार्ज हुए थे, अभी वो दोबारा एडमिट हुए हैं इमरजेंसी में। सर उनकी जो चीफ कंप्लेंट्स है वो ये है कि उनको ब्लड विजन है, ड्राउजीनेस है, इंक्रीज यूरिनेशन है, फटीग है, इंसुलिन साइड से हिमोसिस हो चुका है, और हमने पेशेंट का रिसेंट ब्लड शुगर करवाया वो 495 mg पर DL है। अकॉर्डिंग टू मेडिकल रेसिडेंट्स इन इमरजेंसी उन्होंने से 2 ml पर आर पे इंसुलिन स्टार्ट किया है। सर हमने यूरिन कीटोन सर आई ये कमला जी पेशेंट है जो कि आपके मतलब 35 को 28 जुलाई को डिस्चार्ज अभी दोबारा सर जो मैंने आपको बताया था कंप्लीट उसके अकॉर्डिंग ये सर आए दोबारा हमारे पास। अच्छा, इंसुलिन कितने पे चल रहा है? सर इंसुलिन हमने 2 पे चलाया था, 12 पर आ गया है। और कितना है आरबीएस रिसेंट अभी? आरबीएस सर 495 mg पर DL पे है। अच्छा जी, ठीक है ठीक है। तो आप ऐसा करिए, मैंने इन्वेस्टिगेशंस लिख दी है, ये भिजवा दीजिए। और पेशेंट का आरबीएस चेक करते रहिए, ठीक है सर, ठीक है। साथ में आप क्या करिए, एक जो पेशेंट एजुकेटर है हमारे, हाँ जी, उनको बुला लीजिए और अटेंडेंट से पूछ लीजिए वो घर पे किस तरह से लेते थे इंसुलिन। ठीक है सर, ठीक है, हाँ जी जी, चलिए। गुड मॉर्निंग बबीता जी, मैं शिवानी बोल रही है आपकी जस्ट। हमारे पास एक पेशेंट है बेड नंबर 5 में मिस कमला। मैं चाहती हूँ उनको डायबिटिक और इंसुलिन एडमिनिस्ट्रेशन के बारे में प्लीज बता दीजिएगा। ठीक है, थैंक यू।
अच्छा, बोल रहे थे यहाँ पे डॉक्टर और इंचार्ज थे कि एक जो इंसुलिन के बारे में बताने के लिए हमें कोई एजुकेट करने के लिए आएगा अभी, तो हम उनसे जान लेते हैं कि कैसे क्या करना है हमें। बच्चे को ऐसा समझ लगे। हाँ बिल्कुल दीदी, हाँ जी। नमस्ते, अभी है ना बबीता कश्यप है, मैं यहाँ पे डायबिटिक, तो मैं आपको ना इंसुलिन थेरेपी के बारे में बताने आई हूँ आज। हाँ जी, आपकी अटेंडेंट आपकी आपके साथ में रहोगे ना, घर पे भी आप ही है ना, मतलब लगाओगे इनको इंसुलिन भी। मैं ना ये जानना चाहती हूँ कि आपने घर पे कैसे इंसुलिन लिया? मैम इंसुलिन घर पे 3 टाइम ले रहे थे, सुबह ब्रेकफास्ट से पहले और लंच से पहले, रात में। आपने अच्छे से हैंड वॉशिंग कर लेनी है।
अब देखो ये नाभि है, नाभि से 4th फिंगर का गैप देके इधर से भी 4 उंगलियों का गैप देके, इधर से भी 4 देके, इधर से भी 4 उंगलियों का गैप देके आप चारों तरफ लगा। अब देखो जैसे कि हमने इंसुलिन फिल किया है, आपने क्या करना है, जस्ट टिश्यू को पुल करना है, स्किन को, उंगली और पूरा 90 डिग्री पे सुई अंदर डालिए और दे देना। और लगाने के बाद में उसको रब नहीं करना है जी, रोटेशन करते रहेगा। जैसे आपने सुबह यहाँ पे लगाया, दिन में यहाँ पे लगाइए, रात में यहाँ पे लगाइए। ठीक है, अच्छा रोटेट करना। अभी इसकी वजह से ये है कि आप एक से यूज करते हैं तो उसकी वजह से थोड़ा सा लंब बन जाता है, तो उसको प्रिवेंट करने के लिए हमें साइड की रोटेशन करते हैं जी। ठीक है, तो अभी इनको इंसुलिन लगेगा आफ्टरनून में, तो आप हमारी ऑब्जर्वेशन में। ठीक है, ठीक है, ठीक है। और थोड़ा घर पे आप ना कुछ एक साइन एंड सिम्टम्स भी ध्यान में रखने हैं कि आपको लगता है कि जैसे इनको पसीना आ रहा है, घबराहट हो रही है, कपकपाहट हो रही है, तो इसका मतलब इनकी शुगर डाउन है। तो कोई भी मीठी चीज़ इनके पास रखिएगा और इमीडिएटली वो उनको देनी है फिर उसमें जी। ठीक है, और कोई भी इनको सीवियर सिम्टम्स होते हैं जैसे कि पेट में दर्द हो गया या उल्टी आ जाती है या जैसे विजन में कोई चेंजेस आ रही है इनको, है ना, कोई ब्लड विजन हो रहा है ना, भूख बहुत ज़्यादा लगती है, पेशाब बार बार आ रहा है, तो आपने इमीडिएटली हॉस्पिटल। ठीक है मैम, ठीक है, और खाने पीने का पूरा परहेज रखिएगा। ठीक है, और इनके पैरों की देखभाल होगी जैसे, और दूसरे तीसरे महीने कभी कभी आई चेकअप भी करा लिया। ठीक है, अभी भी जरूरत है करवा लेंगे अभी से। और ये सब चीज़ों का ध्यान रखोगे तो कोई दिक्कत नहीं आएगी आपको। ठीक है, और हमने वो भी जैसे अभी हमें तो ये था कि शायद कम हो गया शुगर, तो हमने कैंडीज वगैरह भी रखी थी, पर बाद में पता चला कि ये ज़्यादा के लक्षण है, तो इसलिए हमने लिख दिया। और जो आप सेल्फ यूज़ करोगे ना, ये आपने वंस यूज़ करनी है। ठीक, तो एक बार लगाने के बाद इसको आपने डिस्कार्ड करना है, और डिस्कार्ड करने के लिए अपना एक प्लास्टिक कंटेनर रखना, उसके अंदर डाल के रखना है, और बच्चों से और घर पे जैसे एनिमल्स होते हैं, हमारे छोटे पेट्स होते हैं, रहना चाहिए। ठीक है, उसके अंदर ढक्कन से बंद करके। और जो इंसुलिन है इसकी स्टोरेज आपने फ्रिज में करनी है। अच्छा, सबसे नीचे वाली शेल्फ में आपने इसको रखना। ठीक है, ठीक है जी, हाँ ठीक है। इंसुलिन तो हाथ पे इसको रोल करो। अच्छा ठीक है, ऐसे करके ना, हाँ जी, तो आप इसको ऐसे रोल कर। ठीक है जी, ठीक है, और जो आप इंसुलिन लगाओगे वो खाने से 15 मिनट पहले लगाओ। ठीक है, ठीक है जी, तो ये ध्यान रखना। और प्रॉपर्ली जैसे आपको जो भी डॉक्टर ने बोला कि शुगर चेक करना, वो चेक करके दिएगा, और उसका पूरा टेबल। ठीक है, तो जब भी आप फॉलो पे आओगे तो डॉक्टर को देखना भी होगा कि कितनी कितनी ऑपरेशन। ठीक है, टेबल ऐसे ही किसी डायरी या नोट पे आपको ना बुक भी दे रही है। अच्छा, तो ये डायबिटिक ब्लड और थोड़ा इसमें खाने पीने की चीज़ हमें आपको ये दे दीजिए ना, और जो आपको डेमोस्ट्रेट किया है वो सारा कुछ इसके ऊपर लिखा हुआ है। हाँ, ये जो भी आप है ना बता रहे सारा है इसमें। ठीक है, यहाँ पे चार्टिंग स्क्रीन पे जो एक आई है ना, उसके लिए कॉन्वेंट पे लिख के देंगे आपको, तो वो उसके ऊपर लगाते रहिए, और उस साइड पे वो ठीक नहीं हो जाता है ना, वहाँ पे मत लगाइए, रिपीट मत करिएगा। ठीक है, रोटेशन का ध्यान रखना अच्छे से। ठीक, कुछ को डाउट है आपको तो आप पूछ सकते हैं। नहीं बस ठीक है, जब हम कोई इंसुलिन हैंड ओवर करेंगे तो हम आइस पैक के साथ आपको वो देंगे, तो घर में जाके आप उसको रेफ्रिजरेटर में रख लीजिए। ठीक है, और जब भी कभी हैं तभी आपने विद एक प्लास्टिक बॉक्स के साथ आइस पैक के साथ उसको बाहर लेके जाना है। ठीक है, ठीक है, और जब बाय भी करते हो तो हमेशा उसकी एक्सपायरी डेट है ना, वो सब चेक करके लीजिए जी। तो अब इनका खाना भी आ गया है, तो आप एक बार मैं खुद लगा देती हूँ, है ना दीदी, अभी खाना खाओगे आप, है ना, तो हैंड वॉशिंग। दीदी अभी मैं आपको इंसुलिन देती हूँ ना, ताकि ये मुझे देख ले, चेक कर ले एक बार, है ना, कि कैसे देना है। अभी मैम 6 यूनिट देना है ना, डॉक्टर ने 6 यूनिट बोला है। और प्रॉपर्ली जैसे आपको जो भी डॉक्टर ने बोला कि शुगर चेक करना, वो चेक करते रहिएगा, और उसका पूरा टेबल पे। ठीक है, तो जब भी आप फॉलो पे आओ डॉक्टर को देखना भी होगा कि कितने कितने टेबल ऐसे ही किसी डायरी या नोट पे आपको ना बुक भी दे रही है। अच्छा, एक प्लेट आप थोड़ा इसमें खाने पीने की चीज़ें का भी हमें आपको ये दे दीजिए ना, क्या है वो सारा कुछ इसके ऊपर। हाँ, ये जो भी आप है ना बता रहे सारा है इसमें। ठीक है, यहाँ पे चार्टिंग स्क्रीन पे जो एक एकाइमोसिस हुआ है ना, उसके लिए कॉन्वेंट पे लिख के देंगे आपको, तो वो उसके ऊपर देंगे। और उस साइड को यूज मत करना जब तक वो ठीक नहीं हो जाता है ना, मत करेगा। ठीक है, क्या रोटेशन का ध्यान अच्छे से। ठीक है, कुछ आपको तो आप पूछ सकते हैं। नहीं बस ठीक है। और अभी भी जब हम आपको इंसुलिन हैंडओवर करेंगे तो हम आइस पैक के साथ आपको वो देंगे, तो घर में जाके आप उसको रेफ्रिजरेटर में रख लीजिए। ठीक है। और जब भी कभी बाहर जाते हैं तभी आपने विद के साथ आइस पैक के साथ उसको बाहर लेके जाना है। ठीक है। और जब भी आप इंसुलिन बाय भी करते हो तो हमेशा उसकी एक्सपायरी डेट है ना, वो सब चेक करके लीजिए। जी। तो अब इनका खाना भी आ गया है, तो आप एक बार
कुछ लगा देती हूँ ना। दीदी अभी खाना खाओगे आप, है ना? तो
हुआ है कट कट के मैम।
दीदी अभी मैं आपको इंसुलिन देती हूँ ना, ताकि ये मुझे देख ले, चेक कर ले एक बार, है ना?
हेलो
अभी मैम 6 यूनिट देना है ना, डॉक्टर ने 6 यूनिट बोला है। ये देखो
डोज ना। जी।
ठीक है मैम।
अगर ये खुद भी लगाते हैं तो जैसे स्पेक्स लगा के अच्छे से देख के, है ना।
ठीक है। अभी ये 6 यूनिट ही है सच। हाँ, ये स्पेक्स यूज करते हैं तो वो लगा के, वैसे इस बार मैं ही देखूंगी मैम, पिछली बार कुछ।
और जब ये खुद भी लगाते हैं तो अच्छा बैठ के चेयर पे बैठ के फिर खुद भी आप जैसे कमला जी आप जब लगाते हो तो पूरा 90 डिग्री आपको ऐसे होगा फिर बैठ के जब आप लगाओगे ना।
दीदी अभी मैं आपको इंसुलिन दे देती हूँ, है ना?
और जब आप क्लीन कर रहे हैं ना, इसको थोड़ा सा ड्राई होने दीजिए अल्कोहल जो आपने लगाया है।
ठीक है। ये ड्राई हो गया है ना? तो इसको ऐसे पिंच करके
जब आप नेडल अंदर जाओगे तो हाँ जी अब छोड़ दीजिए जो आपने पिंच किया था।
ठीक है।
बस लगा के रब मत करिए।
ठीक है।
थैंक यू, आपने बहुत अच्छे से लगाया।
ठीक है दीदी,
कितना
पेन
टाइम
ठीक है, थैंक यू सो मच बबीता जी।
और डिस्पोजेबल का ध्यान रखिएगा, चाहते हैं वो अलग से
अच्छा
हार्ड बॉक्स में करिएगा, प्लास्टिक
ठीक
है
है।
ना।
ठीक है जी। ठीक है, थैंक यू बबीता जी। दीदी आपको कुछ पूछना हो?
कुछ पूछना है कमला जी?
नहीं बस थैंक यू।
चलो ठीक है, आप ध्यान रखना, अच्छे से फॉलो करना।
थैंक यू सो मच, आपने बड़े अच्छे से एक्सप्लेन किया।
Yeah. So good afternoon, friends. Here we have seen the scene second, where after 35 days, patient was admitted and had been discharged after giving an proper health education and discharge education about insulin administration to the patient. So, Davinder ma'am, why not we discuss about the errors that which we have seen in the scene first?
Sheetal, we should not call its errors. We should call it gaps, because these are the some gap that was left. We can't say this is all the errors, because some information was imparted and some important information was missing. So we call it as a gap in nursing activities. That will be more good.
Thank you so much, ma'am. As we take this gap, so this is a motivation to all our youth nurses so that we can face the challenges with our seniors. So, ma'am, let us discuss about what happened good first
One second.
during the scenario which was displayed in the second scene.
Well,
First thing, that patient had been asked about the permission in
Sheetal,
which language
can you
was
hold on?
he
Sheetal.
comfortable in having the health
Sheetal.
education.
Hello, Sheetal. There is severe echo coming. Can you take care? Any other systems on? There's a lot of echo when you're speaking. Your dialogues will get lost. Can you try again, please? Sheetal, come on the video. Let's try again because there's a lot of echo that was coming. Yes, Sheetal. Can you continue?
So if we talk about the good points, so in the first scene, we have seen there are the gaps because when the nurse has imparted the education, some lacunas were there. So in the second scene, we have taken some more activities, more points we have taken care. So good point was first the patient was asked in which language patient can understand of hyperglycemia, signs of hypoglycemia was also told to the patient, and how to take insulin when patient has to travel, where to store, in which part of the refrigerator we have to keep the insulin. So these are the good points that we have discussed in scene 2, we can say the video 2. If we talk about the gaps, because in first scene the patient sign and symptoms of hyperglycemia was not told to the patient. One syringe was patient were using for almost 1 week, and patient was storing the insulin at the room temperature. So these things went wrong, and for that, due to these gaps in the education, patient has to get readmission with diabetes ketoacidosis. So this is the main gaps, and the second video we have seen how the nurse can improve those gaps and which can give the more education to the patient, and it can be the cost effective because patient doesn't need to get readmitted just for taking care of the insulin administration. Over to Sheetal.
Thank you so much, ma'am. Here, I would like to call. Yes, I would request Dr. KP Singh, our endocrinologist, to come on the video for the FAQs.
Dr. KP Singh here.
Yes, yes, madam.
Good morning.
Hello,
Good morning,
sir.
Good morning. Good morning.
Can you start your video, sir?
Yeah. I'm on the video.
He's on the video, ma'am.
Yes, I can see now. So I'm going to pin sir also. Yes, sir. I don't know if you remember me.
Yeah. How are you, madam?
I'm great.
No.
Thank you. And thank you so much for joining. We are
Okay.
honored to have such a senior person, in our Empower Hour. We are really, really thankful to you. So
Okay.
let me leave you with Sheetal for her FAQs.
Okay.
Over to you.
Please. Yeah, thank you. Thank
Good
you.
morning.
Good morning, all the members of this very esteemed organizations, and for educating the young nurses, because ultimately we are going to help the patients, and really that's a very good initiative from the nursing. And am I audible?
Yes, sir, you are audible.
Okay. Please ask me any questions, whatever you want.
Yes. So as you was there, firstly, thanks to be throughout the session. As you've already seen that our nurses are demonstrating on discharge how we will be administering and taking the re-demonstration of insulin administration. So I would like to know from you, is there any, how much important is a nurse in and discharge process to administer the insulin to the patients? What do you think? What is the nurse's role? Is that important?
That without the nursing staff, the patient management in any department, anywhere, it is not possible. So nurse is the first pillar of the medical management or the surgical management of any patient. So without nurse, the treatment is always incomplete. The management is always incomplete, whether inside the hospital or telling the patient the treatment in the outpatients. So nursing is the first pillar and very important pillar. Without that, it is not possible to manage the patients.
So would you like to suggest anything, as you have seen the video? Would you like to add on in the techniques of insulin administration?
Yeah, it is very important that whenever like you have, like any doctor or a nurse, but has to be trained, and the trained has to be the degree or the diploma, and then that certification has to be updated yearly or every 2 years. So training is very important for the nurses. And same, if you are trained, then you can educate the patient for diabetes education. So very important, because now you have many. Some insulin can be given after the dinner, like glargine, or any time of the meal, but the same time, or deglutide. But some very short acting insulin, very fast acting insulin, like the Fiase, fast acting part, or the Epidra, the glulysin, that can be given before the meal, or during the meal, or after the meal, because the duration of action starts within 2 to 5 minutes. So that can be given before, during, or after. But when you have the mixture, the like mixed starve or insulin 30/70, or now that you have the combination of the Rizodeg, now that has to be given at least 25 to 30 minutes before meals. So that is the every injections you have to take care of. Once, like the glargine is U100, the Lantus is U100, but the Trugio is a glargine U300 from the same company. So if we are using U40, then you have to use the syringe with the U40. If you are using the insulin U100, then you have to use the syringe with the U100. So it has to match the type of insulin has to match with the syringe. So it's very important. And before meals or during meals and after the meals, you can again up titrate.
Thank you so
Please
much,
ask
sir.
me any more questions.
So what diet would you recommend to diabetes patients that our nurses can tell them on a quick tip, that which is the diet that patient would say, or which safely they can consume?
Yeah, very important question, madam. I would like to tell that the respectable, delicate nurse and all the audience that the diet is very important, and that will continue. It's not the injections. First thing comes the diet. In the diet, there is no role of the sugar, sweets, sugar and sweets. You have to stop it in any form. Even the jaggery. Jaggery is very common in the North India. Jaggery, good kha lete hain. So then you have to stop that, because you can use only sugar when you have patient has a hypoglycemia. Otherwise, in a day-to-day practice, you don't have to use the fruit juice or the simple sugar. Second thing is the carbohydrate and the protein. This, it is better to give them a little more high protein diet and less of carbohydrate, because if you are taking like the rice, potato, maize, that contains the high carbohydrate, the sugar may rise. So even if you are using these carbohydrate, then you have to restrict it. It is better to use that multigrain flour, multigrain atta, or with the black grains, mixed with the black gram, or you call it in the general language the besan. So that will be better. Potato, rice, and maize, you have to restrict it. And if the patient has the high blood pressure, then you can restrict the salt also. So that is very important.
Okay. So from the group, we have got one question, that what is the recent advances of treatment of insulin resistance that you can share with us?
Yeah. Then, madam, let me tell you very important questions. In type 1 diabetes is insulin deficit disease. There is a complete deficiency of complete deficiency of insulin type 1 diabetes. From the day one, immediately patient has to be on insulin. But the commonly we see 98% the type 2 diabetes. And the type 2 diabetes is almost always the insulin resistance is a characteristics. So that's why after the diet, the first drug to use in that the metformin. The metformin or the pioglitazone, they are for giving for to reduce the insulin resistance. So insulin resistance is relieved by or reduced by one, exercise, two, by giving metformin, by giving pioglitazone. Pioglitazone, sometimes there is a contraindications. So you may not use the pioglitazone always. In the cardiac patient, you avoid the pioglitazone because that can retain the fluids. So these are the important marker for the insulin resistance, and some injections. GLP-1 injections are always there, like the Victoza, or in some combination of insulin and the GLP-1 analog, like Jultropy. So that also reduce the insulin resistance. So insulin resistance is important, and then you have to treat this insulin resistance in type 2 diabetes. Yes, madam.
Yes, sir. So what is that one take-home message that you will give to nurses?
One take-home message is that first, before telling the patient, first read the instructions of a doctor. And if you have the doubt about the doctor, then you can ask again the doctor to review the prescription. Because if the sugar is 400, in a small child, type 1 diabetes, then you will use the insulin as only the 4 units or the 5 units in child. But if it is the 400 sugar in the type 2 diabetes, then the insulin dose may be 14, 16 units, the same, with the same value. So, but if the elderly patients or the patient having a renal failure, even the sugar may be very high, but you have to use a small dose, renal failure patient. Because same small dose can relieve the hyperglycemia, and if you increase the more insulin, then the hypoglycemia is very common, especially in the children, elderly people, in the renal failure patients. But in the young patient, and even sometimes you have seen that patient is on the high dose of steroids, like in the COVID or the neurological patient, Solumetrol, or the patient on the prednisolone for the lung disease or rheumatoid arthritis, then there is insulin resistance. Then the patient will require more insulin. So keep in mind that the patient or dialysis patient is having renal failure, and the doctor has written very high dose. Then you can again ask the doctor, really you want to give this high dose insulin to this renal patient? Because sometimes the doctor may be wrong. Doctor is not always right. The carry-on message is always use your sense, use your common sense, and you can again ask the doctor to review your treatment. And educate, and then you have to just I was seeing the video, very important video. The organizations were showing to the young nurses that what is the error and what is the gap. Because when there is an insulin is a protein, and then you have to maintain the cold chain. So cold chain maintenance is very important in case of insulin. So cold chain has to be maintained, and patient has to be treated for the cold chain. The temperature, sometimes the patient put that insulin pen in the deep freezer, where the temperature is in the minus. So you have to use this insulin in the main compartment, not the deep freezer compartment. So maintain temperature between 4 to 8 degrees centigrade, not below 4 degrees centigrade, not above, and you should not keep in the high temperature. Yes, madam. Any other questions, please?
So last, we have just got one more question, that how to identify the potency of used and reused insulin vials.
Yeah, it is very important the how to use the potency, because one thing, the cold chain has to be maintained, and then if it is the vial, the insulin syringe has to be matched. Whether this is a 40 or U40 or U100, it has to be matched with the same. So always do not remove the wrapper of the vial, because otherwise you will forget what type of insulin. So always check with the bill also, always check with the prescription. So check with this, with that, and it has to be maintained properly in that. And I forget what was the second aspect of the question. Pardon.
So used and reused vials potency. That is that was only the question.
Yeah, you can use up to 1 month. There is no harm. The pen and the insulin can be used for 1 month. And
Yes.
but the needle you have to keep on changing after 1 to 2 days. Do not use the insulin needle very prolonged, because it may give the infections. It may be blunted at the end. It may give the trauma to the patients. But and don't use the very common error is that patient using the Dettol on the skin and then injecting the insulin, because the Dettol it can cause the burn in the patient in the skin. And when you after Dettol or any spirit you use, and then you inject the insulin, some amount of alcohol or the Dettol will go along the needle, and it is very irritating, and patient can develop local injury at the site. So do not use, if the patient is having the good hygiene, patient is taking bath daily, and then there's no need to put this disinfectant on the skin of the patient. Remember that.
Okay. So we have one more question. As a few of the consultants ask when the patients are specifically traveling and they have an hypoglycemia signs, to just take 10 grams of sugar and then add in the water and consume it for the hypoglycemia. So is there any recommendation that these patients can take candy or chocolate for hypoglycemia?
You can see that you have to keep in whenever the patient is out of the house or there is no attendant. This ready-made has to be kept with the patient, and do not keep in the bag. Sometimes it is in the check-in package. Patient in the flight, and patient is not able to call even the air hostess. So it has to be in the pocket, ready-made pocket. If patient is sweating, patient can check the blood sugar after 5 minutes, 10 minutes, but immediately trembler or patient feel uneasy or having the increased appetite, immediately sweat out. Otherwise, patient can become drowsy and it may not be able to control it. So when the patient is alone, even in the first symptom, should sweat the sugar.
Sorry, sir, for the disturbance. I think somebody was coughing badly, so we lost you.
No problem.
We heard that you were saying that plain sugars every diabetic patient should carry.
Yes.
It
should be ready kept, preferably in the purse or in the pocket. No.
Yes.
Yeah. No, not in the check-in baggage, in the flight or in the diggy of the in the car. It has to be in the pocket always.
Thank you so much, sir. This was the last question that we have taken. Thank you so much for your insights.
I think there was one more question. I'm just
sorry. Yes, ma'am.
Yeah, please ask. That's why I'm happy to answer that.
Why do we get high sugar in some post-op cases soon after surgery? Do we need to treat hyperglycemia in these cases?
Yeah. In the post-op, it is better to use the parenteral insulin. Parenteral means the IV infusion, because at the time the stress hormones, especially the cortisol, growth hormone, the catecholamines, they come in the release in the body. So that causes the insulin resistance and the hyperglycemia. So it is immediately post-operative. It is better to use the insulin in the IV infusion or for the short term till the patient starts eating.
Thank you, sir. I think very well explained. I think there was one more question.
Yeah, please.
Is insulin scale mandated on every discharge summary for patients with insulin administration? Any specific advice you have regarding insulin scale when they go home?
Yeah, better to say that this month like 6 unit, like I'm giving the example 6 unit, 6 unit as part of the Nova Rapid before breakfast, lunch, dinner, and 10 unit lentils at 10 p.m. And if I say that if the sugar is less than 130, skip the dose of Nova Rapid. If the blood sugar at the 10 p.m. is like less than 120, skip the dose of glargine or the lentils. And if the sugar is more than 250, then add to this 2 units to the 5 units. So usually we write like that. And if the patient sugar is less than 70, then take the oral glucose.
I think the guidelines are fantastic as explained by you. It becomes even more important how this is being now explained by the nurse to the patients, right? I think in the beginning you rightly told the role of nurses in all this is very, very critical.
Important. I wish you all the best for the society, nursing society, for educating. You are taking very important steps for the young nurses. You are educating them, you are training them, you are explaining through the video. This is very high. This is not only for nursing, but for the society, for the nation, for the whole world. That is very important. And you are taking a very good step and with the United States nursing colleges and the association. A very fantastic job, madam, you are doing for the world, for the society, for the patient, and really appreciate all the job.
Thank you so much, sir. And we are so honored that senior clinicians like you are joining our discussion. And
very
adding-
for the patient management, for the societies, and for the nation.
Yes. Thank you so much. Yes, Sheetal, continue with your deliberations, please.
Thank you,
Thank
ma'am. Thank you so much, sir.
Thank you. All the best.
Thank you, sir.
Thank you, sir.
Thank you, ma'am. As we have seen throughout the scene that it is very important for the demonstration and re-demonstration from patient, attendant, as well as patient in their home care. So this case study highlights the very importance of proper management and control of diabetes. It is important to follow the instructions given by doctors and ensure that insulin is correctly stored and administered, site rotation of the patient every time, and single use of syringe at every time when we administer insulin. So on this point, I thank everyone for this platform that you have offered to us. And one last sentence that I would like to tell to our youth nurses as well as my seniors: learn, unlearn, and learn the things continuously. Thank you so much, Tangam ma'am.
Thank you, Rajbir and team, Dr. Davinder, Sheetal, and all the team. Thank you very much. But before you go, I'm going to summarize, what we learned today. Some takeaways. I really want to give it to all of you because in my own experience, I have seen lots of errors. That happens. Dr. Devinder would like to say they are gaps, but they are serious events which harmed patients, which have the potential to even make a patient die. And insulin is one of the high alert medications, which has got very narrow margin. Therapeutic margins are very narrow. We are not talking about IV insulin today. We are talking about patient going home. So what we saw in the video, I really would like everyone to mute themselves. And some people are very happy coming on the video and disturbing, especially some youngsters. We will give you an opportunity to come on video. So don't worry. Okay. So what I was telling was that, in the second video, in the first video, you saw the nurse is coming, opening the discharge, summary and just simply explaining to the patient. In the second one, you saw the nurse brought the mannequin and then she's demonstrating how to take the insulin. And most importantly, what I liked was the return demonstration. believe me, my friends, that, this is the most important aspect of carry home for all of you. When you teach a patient something, there is a acute need for you to confirm that they have understood. This is called the teach back method. It is one of the, propagated evidence-based communication tool. We all talk about communication. In nursing, we have to be very careful how we communicate, how we confirm that our patients or the relatives have learned it. So return demonstration was here because it was a skill that you are teaching the patient, and it was so good that the attendant was actually demonstrating. I only have one simple request. Please remember, discharge education starts from the time of admission. We should not try to teach patients everything on the last day of discharge. So what happens? I had been in hospital. Now today I'm going home. I'm all excited. Family is all excited. Now Didi is coming home. So everybody is excited. So when too many things are being told on the last day, there is a possibility they will not retain. So I would, always request, because this is a, video, so obviously all that cannot be captured. Very important that you start teaching the patient. Even patient is self-administration. They have to start doing it on themselves while they are in the hospital. So you can observe and you can be very sure that, this is being taken care. And also when you are teaching to a relative, first confirm, is that person going to administer insulin when they go home? I have seen cases where entire discharge thing is explained to any attendant who is standing there. And then when we have problems, when you try to find out why it happened, then you figure out, पड़ोसी आए थे साथ में, वो सुन के चले गए और घर में छोड़ के पेपर छोड़ के चले गए. So the family has no idea. So verify the person to whom you are teaching is the same person is going to give insulin, because I'm just trying to, emphasize on gaps that I have seen which has led to, patient harm. So I wrote those points in my paper, while I was watching. And yes, Dr. KP Singh told many times during my training, even today, when I ask a nurse that what will you do if a patient has hypoglycemic symptoms, even in the hospital? The immediate answer is D25, D10. Why? Even in hospital, you just keep sugar sachet. Give simple insulin first. You cannot kill the patient by hyperglycemia. It won't go that much high. But hypoglycemia can give irreversible damage. So it is better to keep sugar sachet on the wards wherever you have diabetic patients. In case there is something, they can give the patient simple sugar. Usually they answer, we will give, sugar or candy, chocolate, vagera, vagera. There is nothing called vagera, vagera. There is only sugar. That's the first thing you should give. Any complex sugar, if you give, it will take time for the body to break it down and then pump the sugar up. So takeaway, I would always say that please, not only for patients, advising them to carry sugar packet on their pocket or in the purse so that when they feel a little low, they can take simple sugar. And even in the hospital, the first thing a nurse can do if the patient is conscious is definitely to give simple sugar. So I wrote few things here, so that's what I am stressing upon them. And U100 and U40. I had a couple of events when I was working in Fortis itself. Because what happened, if I remember, the store was giving one type of insulin and suddenly they brought another type of insulin also. And nurses, without checking which insulin syringe they had been using, so they were administering wrong dose of insulin. So I had to work with the store people telling, do not introduce anything without informing the nurses, because we have so many nurses giving insulin. They were not checking. You can imagine that if you take a U40 insulin into a U100 syringe, there will be mistake. And if you take U100 insulin in U40, there will be mistake. It can lead to too much insulin or too little insulin. So it is very important as a practicing nurse to check what insulin syringe you are holding in your hand and what is the insulin that you have in your hand. These are some safe practices that you are supposed to be, taking care while you are taking care of the patient. So before that, may I request all the people from Punjab chapter who participated in the role play. Thank you so much. You all can come on the video. Can you come on the video? So let's say thank you to all of you. Can we have all of you come on the video? Those who all participated. Yes, there you go. We can see a lot of Mohali team up on the screen, and there are others also who are very happy to show their face on the video. So thank you so much to Mohali team, and led by Rajbir and Joyce, and of course Dr. Davinder, ably supporting in the discussion. So this is also another point that we services and academics have come together. This is also important. I definitely, the ANEI stands for, ensuring academics are speaking to, services are speaking to, because at the end of it, all of us are caring for patients, and we all want not to harm our patient. Not to harm our patient, some basics are very important. I was only trying to re-emphasize some very practical basic points, and Dr. KP just came and mentioned all that. So those who work with, diabetic patients who are handling different insulin, you have to educate yourself. But when it comes to discharge education, we have to confirm that the patient and the family attendant, they understood. So in the second role play, I was waiting that will there be a return demonstration? Will there be a return demonstration? Oh, then I said, oh, good. I saw mannequin. I was happy. I said, mannequin came. Mannequin can be the first step. Then you will actually tell the attendant, now you give, I'm going to watch. You saw that. My only advice was don't wait till the last day. Start teaching them 2-3 days before, so they have time to get prepared what they need to do. So while we are here, before I open the open forum, I want to tell you a story. Okay. This is about the diabetic. I think last time also, did I say? I don't remember. So doctor said, teach the patient how to give insulin 2-3 days before discharge. And the nurse said, yes, sir. On the day of discharge, doctor asked the patient, Sikh liya insulin lena? And patient said, yes, I learned. And the sister also said, yes, sir, he has also demonstrated. Good. Patient went home. So here it could be a, not so true story, but it's a very important story to remember. So patient came back after a few days, just like this patient, and the patient's sugar was very high. So doctor asked, what are you doing? Are you not taking insulin? So patient told, I'll tell first in Hindi, क्योंकि ये हिंदी की कहानी है. Patient ने बोला कि सर क्या बताएं, जहां हम रहते हैं वहां ऑरेंज नहीं मिलता. I hope you got the point. The nurse was teaching the patient to take insulin on orange. Okay. Return demonstration bhi orange mein hi liya. So patient, obviously they are not medical people to think, so he is thinking, okay, when I go home, orange is good enough. So my insulin, my sugar level will be controlled. So he learned I have to give insulin on the orange. There was no discussion. The nurse assumed that the patient will understand you are just using orange for practical purpose. It's almost like when you want to do IV cannula, one of the cheapest way to do is take banana. Banana ka ridge pe aap in needle lagaenge, so you will get that feeling, no, let go feeling. You can experience that. We all do that, but then we do it because nurses do understand it's not the banana you're going to cannulate, it's not the orange you're going to give insulin. So it's a very funny story, but it's a very powerful one. That why return demonstration or a teach back is very important. It's very important. You people cannot remember. You need to tell. Sorry, can you just tell me back what I just told you? So even for all the teachers and faculty, you can't have everything teach back, but it's very important at times we need to ask them to give it back. Written test, all those things are good, but sometimes basics are getting lost. So I'm very happy that Mohali team came up with these 2 videos. And one more request to all the people who are going to future showcase Empower Hour or anywhere. When you do video, make sure that your audio is taken care of. You need to speak very loudly. This is very important because the audio was fairly less. And I think some people had big challenge of listening. What was the dialogue about? And those dialogue was very important. I was also struggling. So general advice to all the youngsters who are very good in all this in short and all that short, good, but make sure audio is, ask all the characters to speak loudly as though you're doing a drama. That's very important. And if possible, the video camera, the mobile that you're using, if you have a tripod or a stand, put it on a stand so that your hand is not moving. So I'd been learning all these things now for the last 3 years since COVID came. So I'm just sharing those tips also with you. So thank you all once again. And, thank you to the Punjab team. Thank you. And the next one is going to be hosted by Tamil Nadu. And that will be on accidental de-lining of intercostal drainage. So we will be, having this on 23rd of September and maybe one more episode of interesting. And before I say bye, I'm going to ask any of the participants you would like to add anything, any senior people, any academicians, any nursing head, any ANEI member, feel free. Anyone who wants to share something, and then we can say bye to all of us.
Thank you, ma'am. Thank you all the participants. And ma'am, it's very knowledgeable session for all of us also. And we have, during this, when we're making this play, there are many learnings are there. And maybe the next empowering hour is more, will do more, ma'am.
I know all the chapters are learning from each other. So when somebody asserts and come with a new idea, then the other person gets a better idea. So, but I'm very happy that, pre and post, the error that happened, how the gaps could have been, shortened by doing the second video. Fantastic. I just gave general thing for all the other people sitting here whenever you do a video. And one more tip to all of you. You all learned. If you have this video, you can use that in your CNE. In your own hospital, you can show that this is what happened. This is what should have been done. So to all the participants, in case you don't have mannequin, so don't worry. You teach directly on the patient. You can use orange for a first feel, but don't continue to use orange. तो फिर वो ऑरेंज में ही इंसुलिन देंगे तो गड़बड़ हो जाएंगे. Okay, I'd like to tell this story because they remember. So there's a lot of messages coming, thank you so much, Punjab chapter. Some of the dialogues were not audible. It was superb learning. So great. So thank you so much. Kudos to all of you for the effort that was taken. We have, I can see Maharashtra ANEI State Chapter Durga here on the video. Would you like to say something, share something, Durga?
Definitely. It's an honor to say something over here because Empower Hour is full of power with so many nurses joining in for learning. And kudos to the entire Punjab team. Well done, Sheetal, for planning it so well. And thank you so much for the doctors who were so enthusiastic and who were sharing so much of knowledge with all of the nurses. It's something rare to see. So a great coordination happening at Mohali, wherein I can see that how nurses and doctors are working together to make a difference for the patients. So all the best to the team at Mohali. Great going. And it was a great learning experience today because a lot of minute things were focused on. And as always, Tangam ma'am has also pinpointed some pain areas as well as solutions for those pain areas. So thank you, Tangam ma'am. At every Empower Hour, it is a big list of to-dos which we start documenting and start implementing. So as Tangam ma'am had last time also suggested that these Empower Hours should be our training sessions for our nurses who are working in the hospital, and that also takes care of your training record. But a lot of I would say learning in a very simple language which every nurse understands is something which happens in the Empower Hour. So that's a great venture which Annie has always been doing. So thank you, Annie. Thank you, Tangam ma'am. And thank you everyone for enthusiastically participating in this Empower Hour. Thank you so much.
Thank you.
Thank
And kudos to Punjab. You know, they had almost 200 participants when we started. So great
Thank
show.
you, ma'am.
Thank you so much.
Thank
And
you, ma'am. Thank you, ma'am. I want to say something, ma'am.
yes,
So this is all efforts by Punjab chapter. So I appreciate all the organizing team, and even I thank all the participants who have taken their valuable time to learn this very important patient care activity. So in this way, we will empower our junior students, even students have joined that, so that they will learn in future what to do when they will become the professional nurses. So this platform is very good for all the coming nursing professionals, we can say, to whom we have to hand over the responsibility. Thank you, ma'am. Thank you so much for your
Thank you
great
so
effort.
much, everyone, and take care. And God bless. Have a great weekend and see you again September 23rd. Okay?
Thank you, ma'am. Thank you, ma'am.